Thank you for attending Neighbors Helping Neighbors during COVID-19. My name is Carrie Ann, and I am the Chief Programs Officer for the Beach Cities Health District. If you're watching this presentation, it's because you have decided to support your community during these unprecedented times. I want to thank you for that. I want to honor that, and I want to make sure that you have the information necessary to do it safely. During this presentation, we're going to talk about how we identify neighbors who need help, how we keep ourselves safe and them, and some other things to consider in ways to reach out to each other, to stay socially connected during this very strange time. So right now, we know that Los Angeles County, and indeed all of California, has been placed under the Safer at Home order. So this means that only essential services are supposed to continue. Food, in particular, is one of those essential services. Volunteers are especially important right now in this world of social distancing for our at-risk populations, particularly in helping them to get food, and we'll talk about how to do that safely. If you are healthy and able to volunteer, you can help your neighbors in a variety of ways. First of all, we know that under this Safer at Home order, we are all supposed to be self-isolating at home, but there are certain populations of our community which are at higher risk for experiencing severe illness from the COVID-19 virus. Those populations are our older adults, pregnant women, and any individuals, regardless of age, with underlying health conditions. We want to make sure that those folks are most able to stay at home, and they might require assistance from those of us who are healthy in order to do so. We will spend the most of this presentation talking about errand assistance in a moment, but there are some other ways to help vulnerable populations in your neighborhood. First, I'd like to make a call for individuals who are willing to donate blood. We know that right now our blood supplies for the hospitals are critically low. It is safe to donate blood. If that's something you are interested in doing, please reach out to the Red Cross and see about scheduling an appointment. There are other ways to help our vulnerable populations in our neighborhoods without necessarily coming into contact with a grocery store, and also maintaining social distancing. Some things our elderly neighbors might need help with include taking out and picking back up their trash cans, bringing the mail or the newspaper to the front porch. Most of our area has suspended parking enforcement, but you may need to assist with moving a car, and you would want to make sure that you had hand sanitizer and wipes if you were to do such a thing. But perhaps the easiest and most important thing to do within our neighborhoods, and indeed within our own families, is to remain connected. Commit to calling each other a couple times a week. For those of you who are technologically savvy, commit to FaceTime or some other kind of group chat so you can see each other, but really make it a purpose to stay connected, even if it's old-fashioned through the telephone. So let's talk a minute about how to protect yourself from respiratory infections like COVID-19. First and foremost, if you are sick, you need to stay home and stay away from others, even for what feels like a mild illness. One of the most important things that you are probably tired of hearing about right now is washing your hands. We also don't want to touch our faces. Personally, I find this very difficult to do. I've never been more conscious of how often I want to touch my face or how much my nose itches in my life, but here we are. We want to avoid close contact with people who are sick. We want to clean and disinfect our frequently touched surfaces and objects. Pay attention to doorknobs, light switches, maybe the refrigerator handle now that we're all hanging out at home. If you do have to cough or sneeze, you want to use a tissue and not your hand. We also talk in public health about sneezing into your elbow, and I'd like to remind you that if you've done that, you really need to wash the jacket you were wearing also. We want to have an ample supply of essentials at home. We'll talk about that when we talk about helping folks with their groceries. Get your flu vaccine. It really does help to reduce illness during this time. And then I want to say for face masks, a lot of us are very concerned about face masks. At this time, we really need to reserve face masks for our healthcare workers in the hospital. Face masks are not recommended for people who are not sick. They are best used on someone who is sick to prevent that from spreading to others, unless you are having day-to-day caregiving contact, really, close face-to-face contact with someone who is sick. You do not require a face mask. And then finally, stay updated on the travel guidance coming out from the federal government. Right now, we're on a level 4 guidance, which means no travel outside of the United States. So let's say that you have been reaching out to your neighbors and you've identified someone on your block who is either elderly or in one of the high-risk categories. I want to point out that a lot of grocery stores are really doing a very excellent job of wanting to open early for our seniors and give people who are at high risk an opportunity to do their own shopping in a priority manner. The LA County Department of Public Health is telling us now that they really shouldn't go out at all. And so really only healthy people should be doing this kind of shopping, and only people who are not in a high-risk category. I want to say, if you are a volunteer who is in a high-risk category, this really isn't something you should do. Please work with us to maybe be a social contact for folks and work on the phone. But if you are over the age of 65 or in a high-risk category, we'd really ask that you not be the one doing the errand assistance. But let's say you're a healthy adult and you've identified someone in your neighborhood who needs assistance with errands, and you are willing to get them. The first step is to collect a list. Right now, while we anticipate having plenty of supply, it might be helpful to chat with the person you're running errands for and ask for clarification on sizes and brands of items that they would prefer. Encourage flexibility from them if the stores are limited in supplies and perhaps won't have the items they want. Identify any things that they can't or won't use or eat. Dietary restrictions, can you, if they've asked for meat, can you make a substitution or do they not eat pork or beef? Make sure you understand those kinds of limitations so that you have the most flexibility when you're shopping in the store for them. I would also say that we want to pay attention to folks' preferences around the size of items. One of my favorite stories from our own errand assistance program here at BCHD comes from when someone tried to save the senior money by buying the larger size of peanut butter, only to find that that jar didn't fit on any of the shelves in the senior apartment. So it's really important to make sure you understand what their limitations and preferences are while maintaining some sense of flexibility and choice for what you might encounter in the store. You're also going to want to determine payment. Will they write a check when you return? Will they have cash? I would also say if you discover someone who is in need of food but is having difficulty with payment and needs assistance, that you should refer that person into BCHD for support, and we'll talk about how to do that in a second. So you've gone to the grocery store and you've picked up the groceries. We're going to assume you were very successful and you got everything they wanted very easily. I want to remind you to use hand sanitizer when you're out, to use the wipes on the carts. Many of the grocery stores are, as of this recording, are doing that for you, but you'll want to do that as well. And now I would also recommend calling the person on your way back to let them know that you are coming. You want them to leave whatever payment you've agreed upon, the check or the cash, underneath the doormat in the front door, in the mailbox, somewhere so you do not have to physically take it out of their hand. When you arrive at their home, you want to ring the doorbell or knock on the door. Place the items on their doorstep and retreat 6 feet away from the door so that you're maintaining good social distancing. You're going to wait for them to open the door. wave and say hello, ask them how they're doing, have a short chat. Remember, you're 6 feet away, maintaining that social distancing. And please check in with them to see if there's anything else they need. If you discover somebody who's really struggling from a mental health standpoint, or perhaps they need more assistance in the home, or like we said, they're having trouble with paying for groceries, please go ahead and refer them into our assistance and referral line here at BCHD. That telephone number is 310-374-3426, extension 256. We are answering that line 7 days a week, 8:30 to 5:30 right now. So please go ahead and encourage either the person themselves to call in, or you can call in and say, hey, I just delivered groceries for my neighbor, and here's what I think they need more help with. After you leave, you'll want to wash your hands or use a hand sanitizer with at least 60% alcohol. Please remember that this is a contagious virus we're faced with, and you need to take every precaution to ensure your safety and the safety of our community. This only works as long as we keep each other healthy. Again, if you are sick, please stay home and do not go out to volunteer. So just a quick summary. Once you've purchased the items, you're going to ring the doorbell or knock on the door. You're going to leave the items on the doorstep. I should add here just a reminder, if you've arranged for them to leave the payment underneath the doormat or in the mailbox, this is the point where you pull out the payment. We're also recommending that you might want to take a picture of the receipt for the groceries. The person you did the shopping for should get the original, but you might want a picture of the receipt for your records, certainly to match up payment. And if you found somebody who had difficulty with paying, we at BCHD would need that receipt to assist with that. So you've placed your items on the doorstep, you've picked up your payment out from underneath the doormat or the mailbox or the potted plant. You've stepped 6 feet away from the door. They open the door, you wave and say hello, have a nice conversation. If there's any kind of difficulty that they're having or something funky that happens in the exchange, you're going to call our assistance line at 310-374-3426, extension 256. After your leave, you're going to wash your hands, you're going to take good care of yourself, and if you're sick, you're staying home. Finally, just a little bit of volunteering etiquette. You know, you're doing this because you have a good heart, so I don't think I have to tell you to volunteer with a positive attitude, but, you know, be upbeat, be cheerful. You are a ray of sunshine coming to somebody who has been socially distancing and perhaps socially isolated and very worried about how they were going to get their needs met. So you are their ray of sunshine here. Please try to be on time with what you've arranged with them. Do the best job you can. If there really is something that they need that you cannot find, I think right now in this time we all understand that, and we can figure out either between the two of you how to get the item if it's really necessary, or maybe perhaps that's something you call BCHD about and we try to figure out. We also want to take the time to acknowledge and respect others. We don't really want to do, you know, the doorbell ditch thing and just drop the items and run. We really are asking you from a safe distance of 6 feet to take the opportunity to have a quick chat, or perhaps when you are setting up the appointment to take the opportunity to have a quick chat. The other thing we do ask is for you to be discreet. You're getting to know somebody in a very intimate way at a very stressful time, and you may see or hear private information that no one else really needs to know, and we ask that you keep that to yourself. The other thing I would ask is, in this unprecedented time, if you are volunteering with someone, it may make sense for you to adopt them. That's your person, and we'd ask that you would follow up with them on a regular basis or be open to having them call you directly to get assistance if they need it in the future. So also, we talked a little bit about what happens if somebody cannot pay for the groceries. It's really important to us here at BCHD that in this time, people just have food. We want them to have food. So we would ask that, if there is difficulty over payment, you just give them the items and contact BCHD, and we'll figure out how to make you whole. One of the ways we're doing that is by accepting monetary donations from the community. We'll be using this exclusively for the purchase of groceries, helping with picking up prescriptions, cleaning supplies, other types of household goods. We will also be supporting the Salvation Army Meals on Wheels program during this time. So please consider that if you'd like to, you could donate or encourage others to donate to that fund on our website. And then finally, I just want to take a moment to talk to you about your own self-care. We really want to encourage everyone to, take care of themselves. We're encouraging folks to schedule virtual hang time with friends. What does that mean? That can mean a webinar like this. It could mean a lot of FaceTime. It could mean just a weekly or bi-weekly phone call. There are lots of creative ways in our modern era to stay connected with each other. If you're into video games, it could mean gaming at the same time with someone. But just really make a point of reaching out and scheduling times to hang out with people. It is safe to go outside if you are symptom-free and in a non-contaminated area. The county says we may still continue to go for walks. We are asking people not to frequent playgrounds or places where you have to touch equipment because they simply just can't be kept clean fast enough. But it is safe to be in your own backyard or to walk around your block as long as you maintain social distancing. There may be some creative ways to help each other, such as we talked about in this presentation. And then I really would encourage you to reframe your thinking. It's okay to be sad about the things we're missing out on. I think about our seniors in high school who are not going to prom right now. Some of our colleges have canceled graduations. It's okay to be sad about that. However, this is really an unprecedented opportunity for most of us to be a little less busy. And I think in our oversubscribed lives, particularly here in the South Bay in Southern California, maybe it's okay to be less busy. And maybe this is an opportunity to read the book you've wanted to read but haven't gotten to catch up on some magazines, to binge watch the show everybody at the office was talking about that you haven't had a chance to watch. It really is an opportunity, and I would encourage you to embrace the opportunity to downshift and think about what you can do and maybe what are some interests that you'd like to engage in that you didn't have time for before, that now this virus has given you the opportunity. Finally, if you need any updated information on the coronavirus, we are updating our website almost 2 or 3 times a day, it feels like right now. So please feel free to visit bchd.org/coronavirus. We have downloadable resources. If you'd like to forward those out to friends and family who are outside of the beach cities, you are more than welcome to do that. We want everybody to have high quality information at all times. And then finally, if you or someone you know needs assistance or information and referrals, or you just have a question, you can call us at 310-374-3426, extension 256, 7 days a week, 8:30 to 5 here in the beach cities. I think earlier I might have misspoke and said 8:30 to 5:30. Somewhere between 5 and 5:30, we're still answering the phones. So please just go ahead and call. I also want to encourage you to leave a message. If for some reason that phone is not answered live, please leave a message with your name and telephone number. We will call you back, I promise. So lastly, thanks again for your time. Thank you for being willing to contribute to your community in this way. Thank you for looking out for our most frail. Take care of yourself. Stay healthy yourself. And we just really appreciate you and everything you're doing. Be safe out there. Bye.